Dr. Larry Wellikson is the Chief Executive Officer of the Society of Hospital Medicine, the fastest growing medical professional association, now with more than 10,000 members. Dr. Wellikson has held this position since January 2000. Dr. Wellikson is board certified in internal medicine. Dr. Wellikson has served as a trustee of the American Society of Internal Medicine and a regent of the American College of Physicians. He's on the faculty at the University of California at Irvine Medical School. Dr. Wellikson has been a featured speaker on the topics of hospitalists and the emerging specialty of hospital medicine, the hospital of the future, and the role of teams of health professionals. He has helped hospitals, physicians, medical groups, and pharmaceutical companies and national organizations understand the current medical environment and fashion strategies unique to their industries to succeed in the future. Following his presentation, Dr. Wellikson will entertain questions from the audience. Please join me in welcoming Dr. Larry Wellikson.
Thank you, Lene, and welcome. I want to apologize to those of you who have been lined up outside since 6 a.m. thinking you're going to see Dennis Quaid Part 2. I am not Randy Quaid, although I will tell you I was a little concerned when Dennis started talking about patient safety and teamwork and quality that he was going to be giving my talk. I think when my mother graduated Temple Pharmacy School in 1948, she couldn't have imagined the world that we're all going to be practicing in the future. And neither could my niece, who graduated pharmacy school in 1998. What I'm going to talk about today is about as revolutionary as the idea of a world where everybody spoke on the telephone with a rotary wall phone and are now living in a world of the iPhone and email on the fly. Our world is about to change, and everything I'm going to talk about today is being done somewhere. This isn't something that I made up. It's something that I'm informing you of what's already going on out there. And I'm especially pleased to be here at ASHP's meeting because the Society of Hospital Medicine, almost since our beginning, has recognized the unique partnership between hospitalists and pharmacists. If we're going to do the challenging things that are in front of us, we're going to need to do them together. What I'm going to talk about today is a little bit of the changing healthcare environment, some of the challenges facing hospitals, why you should care about hospitalists, new models for healthcare, and a little bit about the hospital of the future. Now, what's going on in healthcare today is that our patients are much more complex and sicker, that you have a large group of physicians managing an individual patient and a whole team of health providers, and that there are multiple transitions and handoffs and opportunities for medical error. At the same time, there's big calls for accountability and for measurement. The hospitals themselves are changing, for the next 10 years, there's going to be $20 billion of physical plant changes in hospitals around the country. And this is an opportunity for changing the physical plant that we work in to make it more attuned to the 21st century. There's a major problem in workload and turnover in nursing. Primary care doctors are giving up their practices in the hospital. Surgeons and subspecialists are narrowing their practices, as well as overcrowding of emergency departments and the ICU. And hospitals are worrying about their very survival, that the number of hospitals that are functional in this country are shrinking each year. There is a loss of public trust. People are somewhat suspicious of the kind of care they're going to get, that there is concern about performance and patient safety. There are workforce shortages, not just in nursing, but in hospitalists and pharmacists and everybody that works in the hospital. And hospitals are very worried about one of their fundamental relationships with the very physicians they rely on to bring their patients. And all this in a context that we need to be thinking much more about value and the quality that we can deliver, but do it at the most efficient cost that we can do.